Okay, let's unpack this. Imagine your pet, perfectly healthy, happy one day, and then maybe within a week, they're struggling. Weak in the back legs, maybe even unable to move.
It sounds pretty alarming, doesn't it?
Yeah, like some strange illness or maybe an injury. But what if it was caused by something, well, tiny, like a tick?
It's actually one of those surprising things in nature and, frankly, a bit unnerving. We're talking about tick paralysis in animals.
Right.
A condition where, yeah, the bite from one specific kind of tick can lead to really profound weakness, even paralysis.
And that's exactly what we're diving into today. We've gathered, the research, veterinary articles, guides, the sources to really get to the heart of this condition.
Mhm.
Our goal here is to pull out the most important bits for you so you can understand what's going on, what signs to look for, and crucially, what steps to take.
Yeah, and these materials, they really highlight how vets understand this paralysis.
Mm.
And the differences are stark depending on where you are globally. Plus, the absolute essentials for treatment and, maybe more importantly, prevention.
Okay, let's jump right in then. So, at its core, what is tick paralysis?
Think of it as a rapid onset weakness or paralysis. It often starts in the hind limbs, then kind of moves forward.
Ascending paralysis?
Exactly.
Yeah.
Vets call it a flaccid paralysis.
Yeah.
That means the muscle become, limp, unresponsive. It can be anything from just a bit wobbly to completely unable to stand or move any limbs.
And this is all caused by the tick actually feeding.
Precisely. It's
Yeah.
not the physical bite doing the damage. It's specific neurotoxins. They're found in the saliva of certain female tick species.
Female ticks, okay.
Yeah, and they inject these toxins while they're taking their blood meal.
Wow. How does a little bit of, well, tick spit cause such a huge problem?
It's fascinating biology, really, but with terrifying results. The toxin works right where nerves connect to muscles, that junction.
The neuromuscular junction.
That's the one. Normally, a chemical messenger, acetylcholine, gets released from the nerve, tells the muscle to contract. Simple enough.
Right.
But this toxin, it interferes with that release, blocks it.
So the brain sends the signal, move, but the message just can't get delivered at the muscle end.
Exactly. It's like the message arrives at the station, but the doors are locked. The sources suggest this blockage is probably linked to the toxin messing with calcium movement into the nerve ending.
Ah, calcium.
Yeah, and calcium's absolutely essential for releasing that acetylcholine. So no calcium flux, no signal release.
Okay, wow. Are all ticks capable of this? And is it the same toxin everywhere?
Oh, definitely not all ticks. Only certain species, and usually the adult females, are the ones producing these specific neurotoxins. And the strength varies wildly.
How so?
Well, the Australian Ixodes holocyclus tick, they often just call it the paralysis tick, it produces a neurotoxin called holocyclotoxin,
Holocyclotoxin, got it.
and that one is significantly more powerful than the toxins from the North American species we see.
I think I saw something in the sources about temperature affecting that Ixodes toxin.
You did. That's a really key detail. Its effects can be much more pronounced in warmer conditions.
Interesting.
And here's a kicker. With that potent Australian tick, Ixodes holocyclus, it can take just one single adult female feeding for a few days to potentially cause severe paralysis.
Just one tick. Seriously.
Seriously, even the younger stages, the larvae or nymphs, can sometimes induce signs too.
That is incredible and scary.
It is. And that holocyclotoxin, it doesn't just stop at the muscles. It can also interfere with nerve signals, controlling autonomic functions, and think heart rate, digestion. That leads to some of the other severe signs we see.
Okay, so recap. Toxin from a female tick jams the nerve muscle signal line. How long after a pet gets bitten or gets a tick does this usually show up?
The sources generally point to about 5 to 9 days after the tick first attaches and starts feeding. Though one source did mention it could be as early as 3 days.
5 to 9 days.
Yeah, it takes a bit of time for enough toxin to build up in the system.
So your pet could seem fine for several days after a hike, and then the signs start.
Absolutely.
Yeah.
That's a critical point for you to understand. And another thing, not every bite from one of these tick species causes paralysis.
Right.
Not every individual female tick produces the toxin, and it seems not all animals are equally susceptible either. There's variability.
That makes sense. Okay, let's shift to who, where, and when. Where is this most common?
Well, the incidence is quite low overall in the United States. But in Australia, it's a much bigger, more frequent problem, significantly higher there.
And is there a particular season for it?
In North America, it's somewhat seasonal. You tend to see more cases in the warmer summer months, logically.
Huh.
Although down in the warmer southern states, it could potentially happen year-round.
Okay.
Australia, though, it's very distinctly seasonal. It peaks in their springtime, that's September through November. Up to 75% of cases happen then, especially after rainy periods.
And which ticks are the main players in different places?
So in the U.S., you're looking mainly at several species of dermacenter ticks. That includes the common wood tick, which is widespread in the eastern two-thirds, plus parts of California and Oregon. And the Rocky Mountain wood tick, found from their Cascades to the Rockies.
Any others in the U.S.?
Yeah, also some amblyomma species, like the lone star tick, Texas, Missouri, over to the Atlantic coast and the Gulf Coast tick, mainly along the Atlantic and Gulf seaboards.
And Australia is dominated by that really potent Ixodes one.
Yes, Ixodes holocyclus along the eastern coast is the big one. There is another, Ixodes cornuatus, the southern paralysis tick, that occasionally causes issues down south and in Tasmania. But holocyclotoxin from holocyclus is the main concern, and it's just much, much stronger than the North American ones.
Got it. Are we talking dogs and cats affected everywhere?
That's an interesting difference, actually. In Australia, yes, both dogs and cats are commonly affected.
Okay.
But in the United States, it's primarily a dog problem. Cats in North America seem to be resistant to the toxins from the dermacenter and amblyomma ticks found here.
Well, that's some good news for cat owners in the States, at least on this front. What about factors like breed or age? Does that play a role?
The sources say pretty clearly, any age can be affected. There aren't specific breed predispositions, and it doesn't seem to favor males or females.
But you mentioned higher risk of death for some in Australia.
Right. For the Ixodes paralysis in Australia, very young puppies, like under 6 months old, and also poi breeds, seem to have a higher risk of a fatal outcome if they get it.
So the big risk factors boil down to being in an area where these ticks live, especially during peak season, and, well, just getting exposed to tick habitats, woods, tall grass, that sort of thing.
Exactly. And in Australia, the sources note higher risk during spring, especially in areas with more rainfall, tree cover, and near water sources.
Okay, let's move on to the signs. What should someone actually be looking for in their pet?
The key thing in the history is often simply knowing the animal could have been exposed to ticks. Maybe they were in a wooded area about a week or so before the symptoms started showing up.
And the onset, you said it's usually gradual, not sudden collapse.
Typically, yes, it's gradual. It most often begins with weakness in the hind legs. They might seem a bit wobbly. Uncoordinated vets call it ataxia, or maybe just hesitant to jump up. This weakness then tends to ascend, moving forward to affect the front legs, usually over the next, say, 12 to 72 hours. That's the classic pattern.
And you mentioned that different tick toxins have different potencies. Does that change how fast this happens?
Oh, big time. A huge difference. With the North American ticks, that ascending paralysis we talked about, it generally takes 1 to 3 days to progress to severe weakness or even inability to stand. Muscle tone goes down, reflexes diminish.
Okay, 1 to 3 days.
But with the Australian Ixodes tick, that progression can be terrifyingly fast. The weakness might hit all 4 limbs, tetraplegia, within just a few hours.
Hours? Wow, that's incredibly rapid.
It really is. And the Australian toxin, it tends to cause more widespread problems than just muscle control.
Like what?
Well, with U.S. ticks, things like difficulty swallowing, what vets call dysphagia or changes in their bark, meow, dysphonia, those are pretty uncommon. And megaesophagus, where the esophagus gets enlarged and food gets stuck, that's rare too. Urination and defecation are usually normal.
But the Australian tick is different.
Much different. Cranial nerve signs are way more common. You might see excessive drooling, what's called sialosis, maybe reduced jaw tone, a weak gag reflex, and definitely that difficulty swallowing, the dysphagia.
And that swallowing difficulty is dangerous.
Extremely dangerous. It massively increases the risk of aspiration pneumonia, inhaling food, water, or even saliva into the lungs. And actually, that change in voice, the dysphonia, can sometimes be one of the very first signs you notice.
So a change in bark or meow is a big red flag in Australia.
Absolutely. A potential early warning sign. And the Ixodes toxin also hits the autonomic nervous system harder.
Meaning?
You might see things like dilated pupils that don't react well to light. Apparently, that's very common in cats with tick paralysis in Australia. Also, potentially high blood pressure, hypertension, and abnormal heart rhythms, tachyarrhythmias.
And the most critical part, breathing.
Yes, this is where it becomes truly life-threatening, especially with Ixodes. The toxin can weaken the breathing muscles, the intercostals between the ribs, the diaphragm. Respiratory muscle paralysis is uncommon with North American ticks, but it's much more prevalent and severe with Ixodes. Animals can quickly develop trouble breathing, dyspnea. They might grunt, pant heavily, use their belly muscles to breathe.
Oh, wow.
Yeah, their gums might turn bluish, cyanotic, from lack of oxygen. And without treatment, it can progress to complete respiratory failure, sometimes within just a day or two.
So breathing difficulty is an absolute emergency sign anywhere, but especially likely with the Australian tick.
Precisely. Other general signs to watch for can include just being tired, lethargic, maybe not wanting to eat. Occasional vomiting or regurgitation can happen, especially early on or if swallowing is affected. Sometimes they have trouble urinating because their bladder gets distended. And collapse is obviously a very severe sign.
That's a whole range of symptoms, from just seeming a bit off balance to literally not being able to breathe. How does a vet actually diagnose this when presumably other things can cause paralysis too?
You're right, the diagnosis is primarily, well, it's presumptive.
Meaning you suspect it strongly based on the clues, but there isn't one single test that says, yes, it's tick paralysis.
Exactly that. The diagnosis is built on really 3 pillars. The clinical signs you're seeing in the animal, being in a geographic area where tick paralysis is known to occur, and then the most critical part, finding and removing a tick or ticks.
Finding the ticks sounds like the jackpot then.
It really is. It's the crucial step for both confirming the suspicion and starting the treatment. The vet team will do a super thorough search. Head, neck, body, limbs, deep in the ear canals, inside the mouth, even checking between the toes and foot pads. Really meticulous.
Leaving no stone unturned, basically.
Pretty much. And for long-haired pets, particularly in those endemic areas, a full body clip is often recommended, sometimes even essential, just to be absolutely sure no ticks are hiding. They might do this under light sedation to make it less stressful.
Okay, but what if they search and just can't find a tick? Does that rule it out?
That's a really important point. The tick that actually caused the paralysis might have already finished its meal and dropped off before the signs even started, or before the animal got to the vet.
Ah, right.
So not finding a tick does not definitively rule out tick paralysis, especially if the signs, the timing, and the location all fit the picture. That's why the history and the clinical presentation are so vital.
And because other conditions can mimic this, what else are vets thinking about? What's on the differential list?
Oh, it's quite a list. They have to consider anything causing similar nerve or muscle problems. Things like botulism, different kinds of acute nerve inflammation like coonhound paralysis, maybe certain toxicities, coral snake bites, black widow spiders, specific chemical exposures, even severe forms of myasthenia gravis or problems right in the spinal cord like IVDD, or severe electrolyte imbalances like low potassium. It's a process of elimination.
Do standard lab tests like blood work help sort it out?
Routine blood tests like a CBC and chemistry panel are often surprisingly normal in the early stages of tick paralysis itself. But they're still vital. They help assess hydration, check for electrolyte issues if there's been vomiting, look for muscle enzyme elevations, which can happen, and check overall organ function.
And if breathing is a concern?
Then arterial blood gas analysis is really important. It tells the vet exactly how well the lungs are working, measuring oxygen and carbon dioxide levels. Severely affected animals might show respiratory acidosis because they can't breathe effectively.
What about imaging, like x-rays?
Chest x-rays are definitely common, particularly with the Australian Ixodes cases. They're looking for signs of complications like megaesophagus or aspiration pneumonia if the animal has inhaled fluids, or even pulmonary edema, which is fluid buildup in the lungs themselves.
Are there more specialized tests sometimes used?
Yes, specialists might use electrodiagnostics. These are tests looking at the electrical activity of nerves and muscles. They can show patterns consistent with tick paralysis, things like reduced nerve conduction speed or weak muscle responses. But these aren't typically the first line of diagnosis for most cases. It's more for complex situations or ruling out other nerve disorders.
Okay, so the diagnosis really leans heavily on the clinical picture. The signs, the location, finding that tick if possible, and then using other tests mainly to check for complications or rule out look-alike diseases. This sounds like a real race against time. What's the treatment plan?
It is absolutely a medical emergency. Prompt, aggressive treatment is key, and that almost always means hospitalization for continuous, close monitoring.
First step has to be getting any ticks off, right?
Yes, immediate and complete removal of all ticks found. That's priority number 1. Using fine-tip tweezers or a proper tick removal tool, grasp right down by the skin and pull straight up. No twisting, no squeezing the tick's body.
And that body click you mentioned.
Can be critical here, especially for long-haired pets, just to make absolutely sure none are missed. After removal, applying a fast-acting tick preventative is a good idea too, just to kill any tiny ones potentially missed or any new ones that might hop on.
Is there an antidote, something to counteract the toxin directly?
There is a specific antidote, yes. It's called tick antitoxin serum, or TAS, sometimes tick antivenom. But, and this is a big but, it is only available and effective for paralysis caused by the Australian Ixodes holocyclus tick.
Only for the Australian one.
Correct. It contains antibodies that bind to and neutralize the circulating holocyclotoxin. It's given intravenously, slowly, and they monitor very carefully for any allergic reactions. Sometimes they pre-medicate to reduce that risk.
So for pets in North America with tick paralysis from dermacentor or amblyomma ticks, there's no antivenom available.
That's correct. For North American tick paralysis, there is no specific antivenom. The treatment relies entirely on removing the ticks and providing intensive supportive care while the animal's body clears the toxin's effects.
And that supportive care sounds like it's the absolute backbone of treatment, especially given the breathing risks.
It really is. It's the cornerstone, particularly for severe cases. Hospitalization is essential, usually until they're clearly turning the corner. If they're hypoxic, struggling for oxygen, they'll need oxygen therapy, maybe in a specialized oxygen cage.
And if they can't breathe on their own,
Then mechanical ventilation becomes necessary. That's using a machine, a ventilator, to breathe for the animal. It's intensive, requires specialist care, but it can absolutely be life-saving in cases of respiratory failure.
what other kinds of support are typically needed?
Intravenous fluids are standard to maintain hydration and good circulation, but they have to be given carefully, especially in those Australian Ixodes cases and in cats generally, because giving fluids too fast could worsen or contribute to pulmonary edema. Maintaining normal body temperature is important to avoiding overheating, which can worsen signs, especially with Ixodes, but also preventing hypothermia. And keeping the patient calm and quiet is key. Stress can definitely exacerbate the signs. For Ixodes cases, a cool air-conditioned environment can actually help, since the toxin is less active at lower temperatures.
And managing those swallowing problems you mentioned, that risk of aspiration.
Critical management point. If there's any sign of weakness, wobbliness, or difficulty swallowing, remember that advice. Do not offer food or water at home. Get to the vet.
And at the hospital.
If there's dysphagia or regurgitation, they'll withhold food and water by mouth, maybe for 72 hours to prevent aspiration. They might use anti-nausea meds, drugs to help the stomach empty, suction the throat or airways if needed. If the animal can't eat for a prolonged period, a feeding tube might be placed. And if megaesophagus is diagnosed, they'll need to be fed in an upright position.
What about just basic nursing care if they can't move?
Absolutely essential. Frequent turning, usually every 2 to 4 hours, helps prevent pressure sores, keeps circulation going, and helps their lungs expand properly. They need soft, clean, dry bedding.
Bladder care, eye care.
Yep. If they can't urinate on their own, the bladder needs to be manually expressed or an indwelling urinary catheter placed. And if their blink reflex is weak or absent, lubricating eye drops or ointments are needed frequently to prevent the eyes from drying out.
Are antibiotics generally given?
Not routinely, no. Prophylactic antibiotics aren't recommended just in case. They're only used if there's clear evidence of a bacterial infection, like confirmed aspiration pneumonia or another secondary infection.
Okay. Any pain relief needed?
The paralysis itself isn't typically considered painful, but if the animal seems uncomfortable, perhaps from lying in one position or from supportive procedures, then yes, appropriate pain medication like opioids might be used.
You mentioned earlier if a tick can't be found in a U.S. case.
Right. If the signs strongly point to tick paralysis, but no tick is found after a thorough search, vets in the U.S. will typically apply a fast-acting topical or systemic tick killer, like fipronil spray, or maybe an insecticidal dip, just to be sure any hidden culprit is dealt with. Often this step, combined with supportive care, is enough to see improvement start.
And are there any medications vets actively try to avoid using in these cases?
Yes, definitely. Certain drugs can actually interfere with neuromuscular transmission themselves, potentially making the paralysis worse. The sources mention avoiding things like tetracycline and aminoglycoside antibiotics, and also procaine penicillin.
Okay, so treatment is really about removing the cause, the tick neutralizing the toxin if possible in Australia, and then intensive, meticulous supportive care for everything else. What's the outlook then? What's the prognosis, and what does recovery look like?
Generally speaking, with prompt diagnosis and really aggressive treatment, the prognosis is often good to excellent.
How fast do pets typically recover in the U.S. cases, the non-Ixodes ones?
For paralysis caused by the North American ticks, once that offending tick is removed, recovery is usually quite rapid. You often see significant improvement within 24 to 72 hours. Noticeable gains in muscle strength should really be apparent within that first day after tick removal.
Okay, that sounds promising. But the Australian ixodes cases are different.
Very different, unfortunately. The prognosis there is often more guarded, and recovery is definitely much more prolonged. This is a really key distinction. The neurological signs can actually continue to worsen for 24 to 48 hours. One source even said 12, 24 hours after the tick has been removed and even after the antivenom has been given.
Worsen even after treatment starts. Why?
It's thought to be due to toxin that's already bound at the nerve endings or still being absorbed. It takes time for the body to deal with it, even with the antivenom helping neutralize what's circulating. So removing the tick doesn't lead to that immediate turnaround you often see in North America. Full recovery can take 3 to 5 days, sometimes longer, and some residual weakness might linger for weeks.
That residual effect is crucial for owners to understand, managing expectations. What's the main thing that causes fatalities?
The primary cause of death, overwhelmingly, is respiratory failure. The breathing muscles just stop working. Or, secondary to that, severe aspiration pneumonia can also be fatal. Without any treatment, death can occur very quickly, sometimes within just 1 to 2 days of signs becoming severe.
And even with treatment, is there still a risk of death?
Unfortunately, yes. While treatment is often successful, especially if started early, a small percentage of animals may still die despite the best efforts. One source mentioned about a 5% mortality rate overall in affected dogs, maybe slightly lower in cats in Australia. Another suggested 2 to 10% might die despite treatment, with the risk likely higher for the severe ilocyclus cases.
Are there factors that make the prognosis worse? Things that suggest a tougher fight?
Definitely. If the animal is already severely paralyzed when they get to the vet, like unable to even lift their head or stay upright on their chest, that's a bad sign. Severe breathing difficulty, cyanosis, or evidence of aspiration pneumonia on arrival, those all worsen the outlook significantly. Also, very young or very old animals or those with pre-existing heart or lung conditions tend to have a harder time.
But if they do pull through, are there usually lasting effects?
That's the good news. If they survive the acute phase, the effects of the toxin itself don't seem to cause long-term neurological complications. Recovery, once it happens, is typically complete.
So monitoring during that recovery period sounds absolutely critical.
It is. Hospitalization for at least 24-72 hours is strongly recommended, especially if there was any breathing involvement at all. While the U.S. cases often show rapid improvement after tick removal, those ixodes cases need really intensive continuous monitoring, checking respiratory rate, effort, oxygen levels, heart rate, blood pressure, neurological status, often for several days because of that potential for delayed worsening.
When are they generally considered stable enough to go home?
Usually, once they can walk reasonably well without significant wobbling or falling, they can eat and drink without gagging or regurgitating, and they have voluntary control of urination again.
And what about recovery once they're back home? Any special instructions?
Yeah, rest is important. It's generally recommended to restrict their activity, no rough play, no long walks for maybe 2 to 3 weeks after discharge. Even though they seem better, the toxin can potentially have lingering subtle effects, maybe on the heart muscle or esophagus. Avoiding stress is also a good idea during that period.
This really sounds like a condition where an ounce of prevention is worth, well, a ton of cure.
Absolutely. Prevention is paramount, especially if you live in or travel to areas where these paralysis-causing ticks are known to exist.
What's the single most effective thing people can do?
Year-round tick control. That's the foundation. Using an effective, veterinarian-recommended tick preventative product is essential. There are great options now, topicals, oral medications. The key is choosing one that works well against the specific tick species in your local area and using it consistently. Many newer products kill ticks very quickly after they attach, which drastically reduces the time they have to transmit the toxin.
So relying on vet-recommended products is key. What else?
Daily tick checks. This is absolutely non-negotiable, especially after your pet has been outdoors in grassy or wooded areas. You need to be vigilant. Make it a routine. Systematically run your hands over their entire body, feeling for bumps. Check between the toes, in the ears, under the collar, armpits, groin area, all those places ticks love to hide.
And keep checking for a while after exposure.
Yes, the sources emphasize this. Keep checking daily for up to 5 to 9 days after potential exposure because of that delay before signs might appear. And if you find a tick, remove it immediately and correctly. Don't wait.
Anything people can do around their own yard?
Yes, some environmental control can help reduce the tick population near your home. Keep your grass mown short. Clear away leaf litter, brush piles, and tall weeds, especially at the edges of lawns or near wooded areas. Basically, make your yard less inviting for ticks and the wildlife that carries them.
Avoiding risky areas altogether.
If possible, sure. Try to avoid walking your pets through known tick-infested habitats, like dense woods or overgrown fields, particularly during the peak tick season in your region. Stick to trails where possible.
I saw a quick note in the sources about acquired immunity. Is that a factor?
It is mentioned, yes. Animals, particularly in Australia with ixodes, can develop a temporary short-lived immunity after being exposed to the neurotoxin. However, it's not considered reliable or long-lasting enough to be a substitute for active prevention methods like tick control products and checks. Don't count on it.
Okay, let's bring this all together. Why does knowing all this intricate detail matter so much to you, the person listening right now?
Because, quite simply, tick paralysis is a true life-threatening medical emergency. And your ability to recognize the early signs and act fast, getting your pet to a vet immediately, can genuinely be the difference between a recovery and a tragic outcome.
And those signs can be tricky, showing up days later.
Exactly. The symptoms might not appear until days after you were in that tick-prone area, or maybe even after the tick has already fed and dropped off. So don't dismiss weakness just because you don't see a tick right at that moment. And remember, the bite site itself usually isn't obvious or painful.
And that critical piece of advice, if you do see signs.
It bears repeating. If your animal shows any signs of weakness, wobbliness, voice change, or especially difficulty swallowing, please do not try to give them food or water at home. The risk of them inhaling it and developing fatal aspiration pneumonia is just too high. Your first step is straight to the vet.
Being prepared for the vet visit helps too, right?
Yeah. Yes. Understand why they might recommend a full body clip, even if you think you checked thoroughly. Be prepared for the fact that intensive hospitalization might be needed, potentially including advanced life support like mechanical ventilation in severe cases, and understand the associated costs that can come with that level of care.
And having realistic expectations about the prognosis is important.
Yeah, definitely. Know that while the prognosis is generally good with prompt, aggressive treatment, it is a very serious condition. There's still a potential for severe complications and, unfortunately, even death, particularly with that potent Australian ixodes tick. Hope for the best, but be prepared for the seriousness.
So when you boil it all down, it really comes back to awareness, prevention, and quick action.
That's it, exactly. Year-round prevention with effective products and diligent daily tick checks is your absolute best defense. But knowing what those early signs look like, the hind limb weakness, the voice change, the difficulty swallowing, and getting veterinary help without delay if you see them, that's essential backup.
It's really quite sobering, the amount of damage such a tiny creature's toxin can inflict.
It truly is a stark reminder of the sometimes hidden power dynamics in nature.
And if there's one single powerful thought to leave everyone with from this deep dive,
maybe consider this. You have this condition, tick paralysis,
yeah,
defined by complex neurological failure, often requiring sophisticated intensive medical care, ventilators, anti-venoms in some cases.
yeah.
Yet, arguably the most critical tool in fighting it isn't necessarily the most high-tech equipment. It's your awareness.
Awareness.
Yeah. Knowing the risk in your area, knowing the signs to watch for, and performing that simple but thorough physical search of your pet. Finding that single tick or recognizing those early subtle signs even if you don't find one and acting on it, that is often the single most important diagnostic step and the most crucial initial action you can take. It might literally save your pet's life. It all starts with you looking closely and knowing what you're looking for.
A very powerful thought indeed. Thanks so much for walking us through all of this critical information.